Dr. Aronoff, first of all, what makes this coronavirus different from SARS and H1N1 and other things that have happened, but certainly did not require the kind of response that we've had to this?
Yeah, really good question. I think one of the main differences between this particular coronavirus and other respiratory viruses we've had to deal with, including other coronaviruses, is just how easy it seems to be to transmit this virus. That's a key difference. And also, it causes pretty severe disease. SARS also caused severe disease, but it wasn't as transmissible. So this is quite a combination.
Do we have any idea how long that Americans need to kind of hunker down and be prepared to quarantine and avoid being together with other people?
Well, I sure hope it's sooner than that. We look at the experience right now in countries that have already gone through a lot of this coronavirus pandemic: China, South Korea, and Italy. And we're starting to see some cresting, reduced numbers of cases, particularly in China. And that's over the course of more months as opposed to 18 months. And so I'm certainly more optimistic that we're in the range of months and not something as long as a year or longer.
A lot of people have sort of ignored this and said, it's not that big a deal. Not that many people have died. Explain to us why this is a big deal, such a big deal that you saw Major League Baseball, NBA, March Madness all canceled. Deep down, we should know that that doesn't happen unless it's a big deal. Why are people missing understanding that?
Well, it's an interesting time. We've never really seen anything like that in recent history. And I think one of the important things we're realizing about this virus is that most people that get infected with it are, in fact, asymptomatic or have very mild symptoms. And it's really about 20% of people that have a difficult time with this infection and need perhaps to be hospitalized. And we're seeing 10% or so needing to be in the intensive care unit. And somewhere in the range of 1% to 3% of people who get infected are dying from this infection. But because the vast majority of people who are getting infected either don't know they're infected at all or have very mild symptoms, I think it can lead to some complacency.
You are an expert in infectious diseases, so I'm getting your perspective and interested in it. What has the federal government and the local governments done that has given you a sense that they're doing it right? And what gives you grave concern that they may not have quite hit the mark?
I think what we're faced with is that the country is a very large country, and coordinating across states and coordinating both from the top down, from the federal government into the states, and from the bottom up is a big machine. It's hard to do. And I've been personally impressed by how much more open the lines of communication are and how much people are respecting each other's roles in this. But we're certainly learning a lot, and we'll probably be a very different nation in terms of how we handle things like this in the future.
There's been a lot of conversation the last several days about the malaria medicine and the fact that it's been on the market for 50 years. I realize there haven't been clinical trials and a lot of scientific evidence, but there's certainly anecdotal evidence that it has a very curative effect upon COVID-19. How much stock are you putting in the use of the malaria medicine as a potential cure for coronavirus?
Well, I think it's really a mixed bag. It's very promising and it's inexpensive and it has a very long safety record in human use. And all of those things are really good. But we don't yet know how much better it is or if it is better than just doing standard supportive care. What we're hearing is promising, and that's great. I think Tony Fauci from NIH suggested at the press conference from the federal government that we do need to be very careful and study this and see how much benefit we're really getting. I'm excited about the fact that this is a safe medicine and it's inexpensive and could be rolled out pretty well, but I don't know yet how effective it'll be.
Dr. Aronoff, we hear a lot of people tell us that the main things we can do is wash our hands a lot, avoid touching surfaces, and practice social distancing. I mean, we get that, but are there other things that we should or could do that maybe we haven't focused on as much?
At the individual level, you really hit the nail on the head. It's not touching your face and being able to remember to engage in hand hygiene with soap and water for 20 seconds, or reaching for hand sanitizer if you don't have soapy water. Remembering not to shake hands, not to engage in hugs, and coughing into the crick or corner of your elbow instead of onto your hands, and really trying to be a homebody and not going out in public unless absolutely necessary. Those are individual levels of things that we can try to do, but even those simple tasks can be sometimes challenging and we forget. So it takes a lot of communication and just a lot of focus.
My guess is that of the many years you've taught medical students about infectious diseases, those students are sitting up a little straighter these days, listening to the lessons that they need to understand about infectious diseases. Is there one particular message that you're trying to get across, even to your students at Vanderbilt, learning about infectious diseases that maybe they've not thought that much about before?
Wow, I love that question. I've not been asked that question before, but it's really important. I think one of the main lessons that we keep learning about infectious diseases is how much they can disrupt society, politics, culture. They can lead to wholesale changes in the way that we interact. I mean, I bet coming out of this experience, we're going to see a lot more people working at home or doing meetings online. A lot of the fabric of our society, not just here in America, but around the world, is going to be transformed by this COVID-19. And there aren't that many medical conditions outside of infectious diseases that are just that powerful.
Dr. Aronoff, I want to say thanks so much for giving us a very practical and sensible understanding of this horrendous situation that we're facing. But you give us a lot of hope and a lot of comfort. And your students are fortunate to be able to have you in the classroom, helping them to better understand it. And we're grateful to have you help us better understand it. We hope to see you soon. Thank you, sir.